It is time now for Ask the Vet with Dr. Joel Conn from the Pismo Beach Vet Clinic. Welcome, Dr. Conn.
Thank you. Good morning.
Good morning. I'm doing great. How are you?
I'm good. I hear you have a new puppy.
We have a new puppy. That's right. We have a little Basset Hound puppy who is 10 weeks old now.
Congrats.
Thank you.
Very cool.
Thank you very much. We'll be coming to pay you a visit
very
soon.
So I thought this morning we would talk about pancreatitis. We talked about this about a year and a half ago, and I was amazed by how many people really had a lot of questions about it and had kind of heard of it but didn't fully understand it. And it's actually a very common condition that we see in dogs and cats, actually. Here's a kind of a nice picture to start your day. This is the picture of the stomach, and the kind of top right-hand corner, that's the stomach, and then it goes into the small intestines. And that sort of grape cluster-looking structure there is the pancreas. And the pancreas's job, and we have the exact same anatomy as the dog and cat, is to, number one, produce insulin. So diabetics are very familiar with this. And number two, to produce digestive enzymes. So it helps you kind of digest your food and absorb nutrients. And what happens in pancreatitis is the pancreas becomes inflamed and in some cases starts to digest itself. So it can create a really nasty condition that can be very, very acute, just sudden onset, very, very sick animals, or can actually become more chronic. And actually dogs tend to get the more acute form, cats tend to get the more chronic form. And what happens is these guys can have symptoms ranging from vomiting, here's a kind of a close-up shot, from vomiting and diarrhea to just a painful kind of hunched belly, and there's this very classic hunched posture that dogs and cats will get with this, to sometimes high fevers and just general lethargy and illness. The trouble is we don't know exactly what causes this in dogs or cats. We've identified kind of some risk factors to avoid, and I think this is kind of what I want to talk about today. But the truth is, most often this is an idiopathic condition. Idiopathic means we don't know what causes it. It's kind of a fancy word for that. But we have identified some risk factors, and we'll talk about some treatments. So the risk factors in dogs especially are high-fat diets. They've done some studies where they've identified animals that present for pancreatitis. A high percentage of these guys have gotten into the garbage recently or had some table scraps or something that their body wasn't used to. And it may be normal, healthy food, but they're just not used to handling it. Obesity is a huge risk factor, and this we see even more so in cats. And then concurrent illnesses. Diabetes is a huge one. There's a condition called Cushing's disease, which many dogs we see that in, and that can predispose to this. And then the other thing is breed. Breed plays a huge role here. So there are certain dogs that are predisposed. Schnauzers are a big one, and there's many others. So what can we do about it? So the first thing is, I think every owner should be aware of, is avoid table scraps, and we say this again and again for various reasons. And just be cognizant of how that trash can is contained. Make sure it's locked up if you have a dog or a cat that can sneak into the cabinet and spill that over. And make sure that you're working with your veterinarian, that you bring your animal in every year for a yearly checkup, because sometimes we can identify these risk factors like obesity, like concurrent illness, that can lead to pancreatitis. The good news is we can treat it. This can be a very, very serious, even life-threatening condition, but if you identify these symptoms, vomiting, diarrhea, malaise, and get your animal in quickly, we can help with anti-vomiting drugs, antacids, fluid therapy, and in many cases something that we don't think about, pain control. Pain plays a big role in this condition.
Sure, exactly. And so you said this could be life-threatening if left untreated?
It can be. Even if you treat it quickly, it can be. So it's important to really identify it and again, try to avoid, we always talk about prevention is the key, and, kind of avoiding some of these risk factors. So, the next time you think about, putting your dog's pill or thing in a hot dog, maybe decide to use a little piece of chicken instead. So fatty foods, potato chips, hot dogs, things like that. The 5th of July is a huge day for pancreatitis in this country because of you dogs getting into these barbecues and fatty foods.
That makes sense.
Especially with curious little puppies.
Yes, exactly.
Since both of our puppies are right at 10 weeks.
All right, if you have a question about your pet's health, email it to askthevet@kcoi.com. Thank you, Dr. Joel Conn. We appreciate it.
You're welcome.
Always like to see you.